Incorporated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. And this evening we're going to be talking with a foot and ankle surgeon, and we have some new info. He's no stranger to the program, Dr. Clive Woods. He's been a foot and ankle surgeon as long as I've been involved in healthcare, which is at least 6 years, but I think it's much longer than that, and I'm going to tell all the listeners and viewers. And then, we're also on Facebook Live. You can find all the shows there, as well on All County Healthcare's Facebook page as well. So without further ado, Dr. Woods, welcome back to the program. How are you doing this evening?
I'm doing great. Thanks for having me again.
And thank you for joining us on this. I always say adventure in health because we always learn so much. And one of the things I learned just through social media we were talking about is you're going to be, you're on the move here.
I'm on the move.
So after how many years in Boca?
I was there this would have been my 6th year in Boca Raton.
Yeah. That's why I was kind of right about that. Yeah. So you were 6 years in Boca Raton, and we all know West Boca Medical Center and that area. And now you're on the move. I saw on your Facebook page, you're a great follow also. I got to say that. If anyone has the chance to follow Dr. Woods, it's a great follow because everything from the latest things you're doing I always like to learn a little bit about the doctors, a little bit about their personal life because it helps. I know you're a big sports guy. Yeah. But, tell us about this move. So you're starting in Plantation. You started, was it yesterday?
Yeah, I started yesterday. So I'm with Center for Orthopedic Innovations. So I will be in Plantation right in front of West Side Regional. And then I also have another area that I'm going to in probably the next month in Aventura. So it's going to be right across from the hospital.
Oh, love both of those areas. Yes. Plantation's a happening area, and Aventura is where it's at, too. And I haven't been to West Side Regional, but I've had a lot of doctors on from there and heard a lot about it, and another great hospital. So you're right there, you said right in front.
Oh, yeah.
So let me just give out the address a couple times, because I think after what you hear Dr. Woods say this evening, you're definitely going to want to look him up. It's, again, Center for Orthopedic Innovations, Broward, 8251 West Broward Boulevard, Suite 300 in Plantation. And then in the future, we'll let you know when he opens his Aventura office as well. So that's a practice with HCA, Hospital Corporation of America. They have an East Florida physicians group.
Yes.
So you're joining them.
Yes, exactly.
Great. Yeah. That's great news. I'm glad we could get that news out, and we'll let everyone know. So again, you're no stranger to this program. I think we were talking this the 4th time you've been on, so thank you so much for joining us again. But tell us a little, the viewers and listeners, a little bit about what you do, because your medical specialty, you're an orthopedic surgeon, but it's a little different.
Yeah, so I'm an orthopedic surgeon, fellowship trained in foot and ankle. So from a general orthopedic standpoint, I do fracture care, so wrist fractures, forearm fractures, hip fractures, which in Boca Raton I probably did three a week. There's hip fractures all the time. Femur fractures, any lower extremity fracture I kind of deal with. Now, what I did my fellowship in is foot and ankle. So mostly what I would do is bunion, hammer toes, ankle replacements, Achilles repairs, If someone had ligamentous instability, so you had multiple ankle sprains and your ankle's unstable, surgery for that. Flat foot reconstructions, and any kind of bad lower extremity fracture I kind of deal with.
Definitely a lot of metatarsals, I bet, as
yes,
well.
Liz Frank injuries.
Yeah.
I've had a few of those.
Yeah, that's interesting as well. Now, I always pigeonhole doctors or orthopedic surgeons because I think it's great that you guys and gals, you specialize in that and what you fellowship. But I always forget, like I introduced you as a foot and ankle guy, and you already say wrist, forearm, femur. Now, is it true that orthopedic surgeon you treat everything from like the neck down, pretty much?
Yeah.
Okay.
So I trained at University of Miami down at Jackson Memorial, and that's 5 years of general orthopedics. So you're doing trauma. Jackson Memorial Level 1 Trauma Center, we've seen everything. So there's fracture care. You're doing wrist fractures when you're on the hand service, carpal tunnel. So for 5 years, you're doing general orthopedics along with some of the foot and ankle stuff. And then I do a 1 year fellowship where it's just all foot and ankle. So all the complex cases, that's what I did for that year.
The amount of training that doctors do when they say fellowship trained. Before I started the show, I never really knew what that meant, but look it up. I mean, that's an extra set of training.
Correct.
After what we know as residency, we've all seen the TV shows, but you actually do it. You actually live it. I actually talked to a doctor once, and they're like, "Do you know much about residency?" I was like, "Well, I know a little bit about the resident show," and they're like, we're trained for anything. Like they put us through so many hours. I know it's changed a little now because it's going to be a little more politically correct, but they train you for everything, and they put you through. You're not going to be a person who kind of falls asleep. I mean, you've done it all.
Exactly.
And somewhere like Jackson.
And it's great because, when you come out of Jackson, let's say 6 years ago, you were ready for anything. You weren't surprised by any fracture that came in because you've kind of dealt with the worst when you were at Jackson.
Definitely. And I read something about Jackson. I think I've mentioned this lately to the viewers and listeners. They'll have to tell me if I'm right or wrong, but I read that Jackson has the most beds in the U.S. for a hospital. I think it was near 1,500 or something. And I asked a few people, and they said, yeah, it is very busy. And what a great system, I mean, for the Miami community and South Florida in general. So that's great to know as well. So, you do it all, and long time here in Boca, I mean 6 years, but now you're just down the road in Plantation in Broward County and Aventura as well. Now, do you what can you tell us about how you can help seniors in the baby boomer population? I know that's my demographic. I know the viewers and listeners. I talk to them. My parents are baby boomers.
Yes.
What are some of the ailments that walk into your office with that population?
Well, the main thing is ankle arthritis. There are a lot of patients with ankle arthritis, and the gold standard was what we call an ankle fusion, where we pretty much stick the bones together and solidify it that way. Now we're doing ankle replacements, which still gives you the motion of the ankle, and you can still be active. So that's one of the newer, I wouldn't say newer, but over the last 15 years or 20 years has been around, and as time has gone on, we're perfecting it, different models. Right now we're using CT-based, where we can get a CT of your ankle and send that off to the engineers, and they come back with little templates for what we call cutting guides to kind of resect the bone and do the ankle replacement. So that's one of the things, especially as a foot and ankle surgeon, that I offer that a general orthopedist or let's say your sports doc or your hip and knee surgeon don't necessarily do.
Wow, that's like every case is different because we all have different anatomies, even in the feet that we don't really think about.
Correct.
So it's actually sent to the manufacturer, and they actually give you the template to kind of work with.
Yes,
that is great.
Yeah.
I mean, I never even. That's why we love doing this show because. Oh, look, we're scrolling on the bottom. Yeah. That's great. There's your info there.
Perfect.
So if anyone's listening on the radio, I know you're driving around in rainy South Florida, and I'm glad to have you. But we're also on Facebook Live after the show. You can kind of use this. I have people who actually use this as an archive, and there's the info. Yeah. But again, we're here with Dr. Clive Woods. He's an orthopedic surgeon, fellowship trained in foot and ankle surgery, relocating to a new practice. He's been our friend here in Boca Raton for the last 6 years. He's going to be in Broward. Again, it's Center of Orthopedic Innovations Broward, 8251 West Broward Boulevard, Suite 300 in Plantation, and then in the near future, Aventura, Dr. Wood's going to get a Plantation set up, and when he's confident with the way that's working, Aventura is gonna be great for you as well. Yeah. Another great group of hospitals over in that area as well. What age range of patients do you treat?
I treat normally from the age of 12 to the elderly. Like the oldest patient I've had was 105.
Whoa!
Yeah, so
that's great to hear, though.
Yeah. Yep.
That they're actually coming into the office and looking for a better quality of life.
Oh yeah. Well, she was 105, independent. I think her son lived in New York, like Syracuse, New York, and functioned by herself.
I bet you a lot of energy.
Oh, yes.
I mean, I once interviewed, when I was a newspaper reporter, a woman that was 112, and I couldn't believe it. Like, it was so
awesome.
amazing, the energy.
Yes.
And I just got a lot from that. That is amazing. So, yeah, from 12 years old all the way to 105.
Yes.
And I always like to ask that question because with orthos, we never know, because there are some pediatric orthopedic surgeons too that so as well. So that's great that you can start in adolescence.
Yeah.
That's when I started first having my foot injuries, actually, when I played basketball.
Oh, yeah. A lot of ankle sprains.
Yeah, a lot of ankle sprains, and then football as well.
Yeah.
But I actually had an issue with my sesamoids from jumping.
Oh. Yeah.
And my first trip to the podiatrist was to kind of shave that skin off.
Yeah.
And it was night and day, I remember to this day.
Yeah.
That was the first kind of pain I had in the foot. And I kind of mentioned the metatarsal because I've always been having an issue with my left metatarsal right there.
Okay.
But on the top, it's really, I need to come see you because
definitely.
I bounced around a little bit and it's not fixed. And my wife's just going to be like, go see Dr. Woods because I don't want to hear about it anymore.
No problem. I'll take care of it.
It's a weird pain. So, do you have a lot of metatarsal fractures walk into the office?
So, mostly what I see is more of the fifth metatarsal. So, same way which will be right here. So, you can sometimes use the hand. It's sort of equivalent, but in the hand is called metacarpal, but this would be the metatarsal in the foot. And the fifth metatarsal, same way you were playing basketball and you have what we call an inversion injury, which is the ankle kind of goes in that way. You can also have a fracture of the fifth metatarsal. And there's also other fractures, what we call the Jones fracture. So a lot of people know about the Jones fracture from Kevin Durant, Julio Jones, and that's a area of the fifth metatarsal where the blood supply isn't good. So what we normally do, depending on how active you are, if you're a college athlete or a professional athlete, we put a screw in there to kind of get that to heal.
Yeah, and that's great news. I know a lot about the Jones just from reading about it because a lot of sports players, like you said, have had it done. Yep. And we always look that up, like, because when a pitcher has Tommy John surgery, you got to go look it up. It's that UCL ligament, or ultra-collateral. I wanted to mention something about that fifth metatarsal. I knew someone once who slipped on some clothing that was on the ground. I think their uncle had left it at the bottom of the stairs, and they slipped, and they actually, I think, broke very badly that end piece. So that can happen from sliding or slipping too?
Well, it's probably not necessarily from slipping. It's probably when they slipped, they had a twisting mechanism.
There you go,
in addition to that. Because a lot of times I have patients come in like, I did this. And when they kind of, as I explain, they're like, I probably did twist a little bit. So more than likely, they when they were slipping, they kind of twisted and had that fracture.
You got to be like a detective sometime, don't you?
Oh, yes. Yeah. Well, they teach you that in med school,
Ask a lot of questions.
History and physical is one of the biggest things before even imaging, MRI and things like that.
Oh, that's good to know. See, I didn't know that as well. Yeah. And I wonder why, like, sometimes the doctor asks a lot of questions for whatever reason, and you guys and gals are just processing the info and building that, the story of what actually happened.
Correct.
That's great. Again, here with Dr. Clive Woods, orthopedic surgeon, a foot and ankle surgery specialist, fellowship trained. Now, anything going to change with insurance? I imagine you're going to take a ton of insurance.
Yeah, so now actually it's going to be a wider range of insurance. Currently now I'm on Blue Cross Blue Shield, Cigna, Medicare. Probably by the end of the month, things that are pending is Aetna, United Healthcare. I'm also going to be on some Medicaid programs, so Ambetter. So those are programs that I wasn't on before. I'm also on TRICARE. So the range of insurance is going to be a lot more.
But all the majors, it sounds like.
Yeah,
So
for sure.
people can call your office as well and kind of find out a little bit more. I have the number here. It's 954 is the new number, 724-3400, and we'll give that out a few more times. About 30 seconds before our break here, I'm going to try to get one more question. Now, are you going to perform your surgeries? I know a lot of orthos, you have the choice. That's
Yes.
a good point. Doctors can choose where they perform surgery,
Correct.
whether it's hospital or surgery center.
Correct.
So do you plan on doing a little bit at Westside Regional and a little bit elsewhere?
So
or-
there's going to be, you have Westside Regional. Right on actually Westside Regional, there's a surgery center called OSS. So that's one place. Aventura is going to be another surgery place. I'm still going to do my Park Creek Surgery Center, which is on 441. So there's going to be multiple areas. So, you don't have to worry about, hey, I got to drive all the way to wherever to have surgery.
That's a great point.
Yeah.
And I looked that up too. So that when we see ASCs, the acronym, those are
Yeah.
ambulatory surgery centers.
Yep.
They're really growing around
Yeah,
the
and in
globe.
and definitely in foot and ankle is very useful because you can get a lot more cases done. But in addition, infection rates are a little bit lower in these centers. Even like, let's say someone has MRSA, which is the methicillin-resistant Staph aureus. Usually we check for that, and sometimes you can't even have surgery in those places unless it's been cleared by an infectious disease doctor or it's been over a year. So a lot less infection.
Great point. And Dr. Woods, hold that thought. Hard to believe we're halfway there, but we'll take a quick break and be back with Dr. Clive Woods, orthopedic surgeon.
County Healthcare has exciting news for any and all patients with or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization,
Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first.
Welcome back to the You and Your Doctor, Living a Longer and Healthier Life show. And we have Dr. Clive Woods here, orthopedic surgeon, foot and ankle surgery fellowship trained as well. We wanted to have him on the program. Of course, he's a friend of the program. This is his fourth time on, so I'm very happy to have you. But great news, Center of Orthopedic Innovations is where you're at now, Broward County, 8251 West Broward Boulevard, Suite 300 in Plantation, 954-724-3400. As well. They're part of HCA East Florida's physician group, or Dr. Woods' I should say, after 6 great years here in Boca Raton. So I'm very happy for you when I saw this, because I know you're going to be expanding a little. I mean,
Yes.
this is huge. Aventura and Plantation is definitely two areas that are experiencing some super growth.
Oh, yes, for
in
sure.
South Florida. And we need great doctors in South Florida, because one of the things you were mentioned before we went to break, and it's kind of in the news lately, is MRSA's been popping up in locker rooms.
Oh, for
and
sure.
I know it's always been something that they watch in the hospital. But what actually is it?
So there's a bacteria called Staph aureus, and what MRSA is methicillin resistant. So methicillin is in the penicillin family, and so with time, when people have antibiotics, the bacteria kind of evolve and grow, become resistant to it. So that's how they came up with the acronym MRSA, which is methicillin-resistant staph aureus. So you'll see them in football locker rooms. There was actually, I think it was a year or two ago, one of the kickers, I think I don't know if it was the Ravens, but they had like a MRSA infection, maybe Ravens or Tampa, but he had an infection in his foot from MRSA, which, as a kicker, you need your foot.
Yeah, definitely.
So it's just know it's out there, and I'm pretty sure a lot of people know now.
And the hospitals check for in surgery centers as well. There's different things that they do. Okay.
Yeah. Yep.
That's great to know. That's something that, we see in the news, as the, people who aren't maybe physicians or know much about health. And I'm glad, I'm happy that you're able to answer that as well. Sports has been a big background for you. When you were in, was it residency, you trained, or you worked with a doctor who helped with athletics?
Correct. So when I was at University of Miami, I worked with Lee Kaplan, who is the team physician for University of Miami football. So we dealt with the football players. We also dealt with soccer, basketball. He's also for the Miami Marlins, the team physician. So we dealt with the players there too. So it was a great experience. You got to see a lot of sports injury from high level, athletes.
Let me put you on the spot. I always hear turf toe, and I once played with a fullback who had it, and he was in so much pain, but he gritted through it. David Runner back in the day, but man, that was his name. It still is his name. Yeah. But what is turf toe, and why is that so?
Yeah, so what turf toe is that underneath the we call the great toe, and where that metatarsal attaches, so we're going back to the metatarsal first, there's a plate that's really thick, and so when your toe gets really hyperextended, it puts stress on that plate, and you can get either a strain of it or partial tear or complete tear. And the reason why they call it turf toe is because before in football there was grass, so there's a little give to grass. However, with turf, it's not as much give. So wide receivers, when you're running those drills, every time you're pushing off, you're putting stress across that because they need that. They really try and push off to get that burst of speed. So that's when that happens.
That's a great point, because do you remember that artificial turf back in the, when it first came out?
Yeah.
In the 80s and probably early 90s, and before the 80s, probably the 70s, it was hard to play on.
Oh, yeah.
It was like playing on concrete.
Exactly.
Yeah. Exactly. And it had no give, and I always watched that Veterans Stadium back in the day. That stadium, I don't think they play there anymore. Well, no, Eagles play somewhere else, but yeah, there were a lot of issues because the artificial turf had different levels, and I think Michael Irvin kind of had a bad injury there once. Yeah, that watching someone play with turf toe, and then playing football, you get your feet stepped on, and those cleats. They look very durable and everything, but they're not steel toe or anything.
Nope.
And that can be tough. I play defensive line, so I've had a ton of ailments. But sports, so not only football, UM has a huge, amazing athletic program.
Definitely.
We're talking everything from women's golf, their basketball. Last few years, men's basketball has been really on. And so you dealt with a lot of different ailments and seen a lot of things in sports. So that's still a focus for you if any athletes are listening, looking for a good...
Because I do a lot of Achilles, minimally invasive, so, not large incisions, just little small incisions where we can actually fix your Achilles. In addition to that, before with Achilles, we used to say, okay, well, we fix your Achilles, you're off of it for 6 weeks, but we've came up with techniques where we can actually fix your Achilles and have you start walking, sooner than 6 weeks. So that's another thing that I do. In addition, we do Liz Frank injuries. I do ankle instability. That's a big one because before, once again, with ankle instability, when you would sprain your ankle, and let's say your ankle feels, when you're walking on grass or on the beach and it feels unstable, when we fixed that, that was 6 weeks off of your foot. Now, with what we call it's a fiber tape, which is a material that's a thicker suture that kind of protects your repair. I have people on their feet walking 2 weeks. They're in a brace with the shoe. At 4 to 6 weeks, they're back to, I wouldn't say doing any high level jumping or anything, but they can walk. They can at 6. I actually had a cheerleader. I think she was at 6 or 8 weeks. She was jumping and back to cheering. So.
Great point. A lot of gymnastic injuries, a lot of cheerleading injuries as well, because the tumbling and the force on the bones and the ligaments there as well. If you would, can you explain a little bit about Liz Frank? Because I didn't know much about that injury.
So what the Liz Frank is, it's a ligament that runs across the midfoot area. So if you don't really know much about the bones of the foot, it's going to be hard to kind of tell you which ones. But the actual foot has sort of a dome-like structure. So between the second and behind the first, there's a little small bone. We'll call it a tarsal bone. That's what we call generalize all those bones in the midfoot. And that ligament is very important. Sort of the keystone. So if you ever know about architecture, that keystone that's in a doorway that's sort of a circular one, if you pull that out, everything topples down. Same thing with that ligament. It kind of holds the foot, and it's a very important ligament. So when you tear that, usually we have to repair that. And the way we repair that is there's a screw that we put across there to kind of hold it and let it heal. And once it heals, then usually around the fourth month we try and take that screw out, because that ligament that area is meant to be moved, so you don't want it stiff, so we kind of take that out after about the 4 to 6 months.
An amazing explanation.
Yeah.
I mean, the things you're doing and the way medical technology is moving is so great. It's Dr. Clive Woods. We got about a minute and a half. Orthopedic surgeon, Center of Orthopedic Innovations. It's his new office in Broward County, 8251 West Broward Boulevard, Suite 300 in Plantation. And in the future, he's going to have an Aventura office down there, 954-724-3400. We have about a minute left, so what are your hobbies and passions in life outside of medicine? I actually know this.
Yeah, so one is, I have my newborn.
Yay,
Chandler.
congratulations.
So now it's been mostly him, but I usually like to exercise and golf. Golf is one of my passions, so I've been golfing since I was 21. So that's.
Do you have a favorite? Golfers say my favorite track. What's your favorite track?
Emerald Hills.
Oh yeah, I asked you that last time. I remember that. Yeah. I grew up in Jupiter, so I played a little bit of golf early on. But congratulations on your new office, your new baby boy.
Yeah.
And thank you for so much for coming back on the show and sharing so much info with us.
Thanks for having me.
It's Dr. Clive Woods. Check him out now in Plantation in Aventura, 954-724-3400. Thank you, everyone.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.